Now, Health Minister Zweli Mkhize has confirmed COVID-19 vaccines will be free. Briefing the Health Portfolio Committee on government's rollout plan today, he's warned those who intend to sell it on the black market will face the music. The minister's also assured the public that the ongoing power cuts will not hinder the success of the administration of vaccines. Reporter Aisha Ismail has been following the briefing and she joins us now. Hello Aisha, always great to chat to you. So the Health Minister briefing the Parliamentary Committee on Health on the rollout. We've heard quite a few details from various provinces about how they're going to implement in their province. Is he confident that we're on track?
Well, Sally, this was a briefing that lasted for more than 2 hours, and you can imagine that the members of this portfolio committee had several questions to ask the minister. He, for instance, was asked about the price of the vaccines, the efficacy of the vaccines, and then, of course, he was also asked about the state of readiness of the various provinces. Now, we heard some members of parliament talking about a number of provinces that, in terms of logistics, IT, because remember, you need to register online in order to register to get these vaccines. And they were saying, if you look at some people don't even have data, specifically referring to people in rural areas. And so there were a range of questions and concerns raised by members of parliament. But the Minister of Health did assure the members of parliament and, of course, South Africans that government was doing everything possible to get the best vaccines as soon as possible. But let's take a listen to what he had to say.
The question of Pfizer being a high cost, of course, we've negotiated it down, but because they were offering some availability, that was the issue. That made us to look at them. I did say that there are others that we're in negotiations with, but the prices are a bit high, and on that basis, we have to really think carefully about what can we do. But the question at the end is going to be, will we avoid an expensive vaccine simply because it's expensive when it's available? And we know that the efficacy is acceptable. So the answer is no. We can actually procure expensive vaccines provided they will be available earlier, and out of that process, we will then balance up. And that's why we said earlier, it's going to be a multiple supplier program that we're going to be taking.
Aisha, I know that he faced a barrage of questions from the opposition. I wonder if you could pick out for us a couple of things that you found most interesting. I noted that ivermectin came up as an issue, as a talking point. But what for you were the most pertinent issues to come out of the briefing today, beyond what you've already told us?
Well, I think that the MPs talked about how they're going to be able to track the vaccines, how they're going to be able to make sure that vaccines do not come into South Africa on the black market, and also already the minister did point out that all vaccines will be free of charge. But then again, also having said that the vaccines will be procured from multiple manufacturers, members of parliament also raised the question, then if you're going to do this, then that means that some of the vaccines would have to be stored under different conditions. But the minister did say that in some cases where vaccines would have to be stored under minus 40 degrees or minus 70 degrees, they are looking at universities who do have the capacity to store these vaccines. The other question was also brought up, as you said, ivermectin, and he did say that SAPRA was the legal authority to deal with the issues of ivermectin, and that he was not in a position to speak on behalf of SAPRA. But once again, just to reiterate, people were concerned also a lot about the fact that the vaccines appeared to be expensive, and they also wanted to know how the government was going to keep track of these vaccines, and also, in terms of getting people to, get the buy-in of South Africans to go and have these vaccinations once the vaccines arrive. But he did say that everything is on track. They're starting with first phase phase, then the second phase, and the third phase. However, he did say if they do receive the vaccines sooner than expected, then the different phases will also be starting earlier than anticipated.
It sounds like they're trying to speed up that timeline. I know that load shedding and the fear that it could impact the vaccines, which have to be stored, have to be refrigerated, came up. Was the Minister very clear that it will not impact the vaccines? Because, of course, wasting them, spoiling them due to a blackout would be a disaster.
Well, he did say that the places where the vaccines would be stored would have generators, and so they would not then, the vaccines would not be affected by the power blackouts. But then again, one has to look at the various provinces. Some provinces are ready to receive and to store and to distribute the vaccines, but of course other provinces, as we heard, were not ready. But when the minister answered that question about blackouts and Eskom, he appeared to be confident that they were not very worried about that, because they did have generators in place to ensure the cold chain integrity of the vaccines.